Good. Well, good morning, Queensland, and Merry Christmas. We know it's been a really, really tough year, and I just want to take a moment to say thank you to all of the hard work of all Queenslanders coming together as a community and keeping us safe. We've all prepared for the last 2 years for these cases to come in Queensland. Today is no different. There are definitely more cases, but because of the great work of Queenslanders coming out and getting vaccinated, our hospitalisation rates still remain very low. So today there's 765 new cases. That makes 2,147 active cases currently, and I can confirm that 151 of our total active cases have been confirmed as Omicron. We have now 566 people being cared for in the home under our new COVID care in the home model, and others being assessed as we speak to move them into home care. We have 5 people in hospital who are needing to be cared for because of COVID. Of course, we have other COVID positive patients in hospital but are being cared for in hospital for other reasons, including other health conditions. The wonderful news I can report, and I just received this driving here this morning, is that the person who was in ICU has just been moved out. So we have no people in ICU now with COVID, which is just wonderful news and a great Christmas present to know that person is getting better. We did 33,971 tests in the last 24 hours. So thank you, Queenslanders, for continuing to come out and get tested. And we have now hit 90.36% first doses and 85.88% second doses. So we are getting close to that 90% double vaccination rate. And of course, if you are eligible for your booster, please come forward. There are many community pharmacies open. We have GPs over the Christmas period, and of course vaccination centres. So continue to come out and get your booster shots and also your first and second jabs if you haven't already. We only have 650 people who are formally in quarantine, which is in fact much smaller than we've had in the past, and that shows the changes around the rule of casual versus close contact. But we thank those 650 people who are in quarantine, who are probably missing time with family and friends today. We know it's difficult, but we are so grateful for what you are doing. And I just want to reinforce all those people interstate who have done the right thing and got their PCR tests. Late yesterday afternoon, I was told of just one story. 3 young people coming up to be with families in Queensland on Christmas Day. They were all due to arrive last night on Christmas Eve, but were waiting for their PCR test. 2 of those 3 have tested positive, and they're awaiting the results of the 3rd. Now, at least one of these young people were going to be joining a big family gathering today of 25 to 30 family members. At least one of those family members is over the age of 90, and another one is a newborn baby only days old. Those family members have been protected from having a positive case gathering with them because of that PCR test, and those young people doing the right thing and waiting for those results before they sought to travel. So I thank them. I know that they're missing out on time with family today, but that has kept those very vulnerable people in that whole family gathering today safer. So I am so grateful, and I just want to say thank you to them. We have 22 LGAs reported today with those positive cases. I won't go through the whole list, but we will put out a release with all of those. But I can announce that Cook and South Burnett are new LGAs to that list. We do have local government areas all across this state now. When I look at the Cassowary Coast and Central Highlands, Cook, Douglas Shire, down to the Gold Coast, Brisbane, of course, Whitsundays, Sunshine Coast, Toowoomba, Townsville, Scenic Rim. This virus is everywhere now, and we have to assume that anywhere we go, we could be exposed. So remember your masks. Remember when you're gathering with loved ones today, just be careful. Of course, you're going to want to hug loved ones, but just be careful of your surroundings. Good hygiene, masks where you are, particularly around really vulnerable people. We're so grateful for the hard work everyone's done. I know I put out a Christmas message for everyone yesterday, all of our health workers, our police, our fire and emergency, all of our frontline workers, all of the retail workers and hospitality workers who will be working today, and those who are putting on lunches and dinners, feeding people brekkie now. I say thank you. I know it's hard because you're working on Christmas Day. We're very grateful for your work, and remember to show respect to all of these people who are working today and giving up time with family and friends. And my last thank you goes to our Auslan interpreters. And Mikey, thank you. You've been amazing all year. I know he's an absolute hero wherever we go. Everyone wants photos with Mikey. And we have to do it one more time, Mikey, because I saw the social media feed. What is a spider and a huntsman? I'm just glad I don't have one on me today. So, Merry Christmas, everyone. Stay safe. Please just remember your masks, social distancing, good hygiene, all the things we've been doing for 2 years. It'll help keep us safe and slow down the spread of this virus. Again, thank you to our health workers who are doing such an incredible job, and I know have a big 2022 coming up. I'm so grateful for the amazing work they've been doing.
Mr. Merry Christmas firstly.
Thank you.
Just on day 5 testing, do you think when we have a look, there's a National Cabinet meeting coming up which we know, do you think that maybe we might get to the stage where we'll scrap that day 5 test for people visiting here? Obviously we're still doing the PCR test to visit, which you've been quite clear on, but just looking at the day 5 lineups today along Ipswich Road, it is obviously, we're at a point now where there's people feeling well and then they don't have any symptoms, but they're lining up with people that potentially are quite ill, and you can see that there's a mix there.
Yeah, and can I say, well, because I witnessed this myself in the last few days, people lining up to get tests. They weren't all wearing masks. Remember what you're there for. You're lining up to get a test for COVID, so it's sensible, even if you're outdoors in that line, it really is sensible to keep that social distance and also to have a mask on. Look, we've said we'll stop the PCR tests at the 90% double dose, and we're so close to that already. And the Premier, and as I said yesterday, the Premier has talked about the rapid antigen, and we're looking at that currently, and we'll take advice of AHPPC. I'll take advice from the Chief Health Officer. Of course, if we're not requiring people to get the PCR test before they arrive, we will look at the 5-day test as well, because that's all part of the overall package. But I do want to remind people that the positive cases that we are reporting every single day, many of those are from asymptomatic people, fully vaccinated, who we're identifying through that 5-day test. So we need to get that balance right. We're going into the busiest season right now, huge gatherings of family and friends now and New Year's Eve. And we do want to keep people safe, but we'll constantly review that, and certainly at the 90% double dose.
Minister, we know that hospitalisation is quite low, even though cases are quite high, and we hear that Omicron could be a little bit more mild than Delta. Is there a sense that complacency might creep in Queenslanders might not be as fearful of COVID as they possibly should be?
Look, that is possible, but having said that, our vaccination rates continue to go up. Our vaccination rates are over 90% first dose, so of course, everyone who's already got 1 dose are likely, there's no reason why they're not going to turn out in 3 or 4 weeks' time and get their 2nd dose and then their booster. So we are going to get over 90%, well over 90% in our vaccination rates, which, as I said yesterday, in 10 months is an extraordinary achievement for any state, any country, for an immunisation program. So I think people will take it seriously. They are taking it seriously because they're coming out and getting vaccinated. I think where complacency could creep in is just those mask wearing, the social distancing, good hand hygiene. And we just need to constantly remind ourselves, because most Queenslanders don't know someone who's had COVID. In the next few weeks or months, most of us will be able to say we have known someone, met someone, lived with someone, or had COVID ourselves. So that is a reminder to take it seriously.
Where are the cases coming from, Minister? So obviously people are getting tested, they have to prove that they're negative when they arrive. Is this mainly these numbers coming off people's day 5 tests, do you believe?
So there's a number of day 5 tests. There's people just coming out and getting tested. But again, if you're asymptomatic, you're coming out to get tested because you're required to under the day 5, or you've been at an exposure site. So all of these people have either been in an exposure site or are required to get a test on day 5 because they're asymptomatic. They're not coming forward because they're unwell. There's a very small number who are coming forward simply because they've got symptoms. And then we've got a number of people who are showing up positive who are close contacts, family members, household members who are getting infected because someone else has it in the household. So we're seeing a whole mix. That's why I'm not standing here every morning now just giving that complete breakdown of how many interstate, how many local, how many are under investigation, how many are close contacts, because it doesn't matter. Ultimately, there are cases in the community and that's what we need to focus on. Oh, look, inevitably there will be spread of the virus due to gatherings of family members. What I am pleased to know is even just that one example I was given last night shows that we've probably kept out so much more of the virus because of the PCR tests required from interstate arrivals from those hotspots. But inevitably, there will be spread. There will be spread from public gatherings today, family gatherings, and that's why I say if you've got really vulnerable people in your household, whether they're vaccinated or not, just be mindful of that. You may want to wear masks because that person is particularly vulnerable, whether they're a young child who can't get vaccinated or an elderly person or someone with an underlying health condition, they are at risk. And so for that gathering, you might want to wear masks. As the Chief Health Officer said yesterday, and I know other states have been recommending it, you may want to do your gathering outdoors. If you're doing it in fresh air, we know that significantly reduces the risk. So there's measures you can take to hopefully reduce that spread on Christmas Day.
39,000 cases in a fortnight in New South Wales, over 6,000 today. Obviously we're not going to see a spike because we don't have those sheer numbers, but we are going to see a dramatic spike in the next week or two, aren't we?
Yeah, we will get our spike. Our spike is coming. New South Wales obviously is well ahead of us in their numbers because of the outbreaks they've had. But yeah, we will get large numbers. We've said this. We should prepare for this. We've expected it. We've planned for it. And, you know, at the moment, we're getting close to 1,000. We will get 1,000 cases a day. We will get more than 1,000 cases a day. This is what we expect.
Is there a sense of resentment with Premier Dominic Perrottet in New South Wales about taking away that mask mandate right before that massive spike in cases, knowing that, you know, at least 10%, as the Premier said, of those people will be coming to Queensland? Were you slightly concerned as a government that he made that rule?
Oh, look, that's up to individual premiers around the country to decide what restrictions they put in place. We follow our advice from our Chief Health Officer, and I'm very pleased that our Chief Health Officer has recommended masks, and that's what we're doing. What they choose to do is their prerogative, but what Queenslanders need to understand is that especially when we hit the 90% double dose and people will be able to come from those hotspots without doing a PCR test, we will see more cases.
What about how contact tracing is going at the moment? Are we still able to keep up with that, or are the exposure sites just getting too overwhelmed?
So certainly our public health units are still doing contact tracing, but the reason why we released those materials is to help people understand what to do when they get that positive test so they can start putting in place measures to reduce the spread before they get contacted by a public health unit. But you know, those exposure sites are going to get longer and longer. I spoke to the Chief Health Officer this morning. You know, we'll be looking at the categorisation of exposure sites. Again, we continue to do work around the definition of casual versus close contacts and, you know, how many people have to quarantine and for how long. We'll continue to take that advice.
Do we need more resources in that area to sort of keep up?
Look, if the public health unit says it needs more resources, they'll get it. Yeah. Yeah, look, we are keeping up with the demand, but we can expect that there will be lines in some areas and there will be delays in testing because inevitably, once you start doing a large number of tests, we're not going to have that 12 to 24-hour turnaround that we've seen previously. But we are working through those issues. Again, you know, the issues of quarantining while you wait for a test if you're asymptomatic or whether you're a casual contact. We're working through all that. The Chief Health Officer is talking to his interstate colleagues on that and what the national guidelines are. But we'll wait for his advice as to whether there should be any changes. As I say, I know it seems there are a lot of exposure sites. but there are only a relatively small number of people who are actually in quarantine right now. But I do absolutely respect and understand there are many, many more people who are casual contacts, simply gone and got a test and they're waiting for those results. But remembering that wait is about keeping your loved ones safe. No, it's a day-by-day thing. The Chief Health Officer continues to consult with his colleagues around the country and also AHPPC, and looking at the national guidelines and whether there's any changes to those.
Mask mandate in regions?
Well, we have mask mandates across the entire state. It's not just southeast Queensland. I remind all Queenslanders, whether you live in the Cassowary Coast, whether you live Scenic Rim, whether you live on the Gold Coast, Sunshine Coast, Whitsunday, Cook or Douglas Shire, you are required to wear masks when you are indoors in shopping centres, retail, cinemas, theatres, while you're seated in cinemas and theatres as well. We remind people that they must wear these masks, and we strongly recommend when you're going indoors, and particularly today while you're going into venues, hospitality venues, it doesn't take much to just put a mask on while you're walking in. Once you're seated, you can take that mask off, but strongly recommend as you're moving around those venues to put your mask on.
What else can Queenslanders do to help prevent the spread of COVID-19?
Yeah, masks. Masks, 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 and I'm going to say it again, wear them properly. Under your chin, under your nose will not stop you from getting it, and it's also about stopping you spreading it to others. You could have COVID and not know it if you're fully vaccinated, and if you don't have a mask on, you are a much greater risk of spreading that virus to other people in those shops. So if you are going to the Boxing Day sales, enjoy those sales. I know we all enjoy to get out and have a good shop, but please wear those masks and wear them properly, because it is what will help keep you safe and reduce those risks.
What did you get for Christmas?
Well, I've got one child who's at their boyfriend's and another one that's still asleep, so I'll find out when I get home.
Santa visit?
Yes, I'm sure Santa's going to visit me this afternoon. To all those kids, Santa came, and all those mums and dads who I'm sure have been woken up very, very early this morning. I wish you a very Merry Christmas to all Queenslanders. To all of our wonderful media that are here today, who have given up their Christmas morning with family and friends, I thank you as well. Thank you. Have a great day, everyone.